Depression or the blues. You are all here today to learn the difference between everyday emotions of being down or having a bad day and an actual diagnosis of clinical depression. In a minute, you will hear from our guest speaker, Dr. Downs, who will explain to you the definition of depression, the signs and symptoms, and then the characteristics of everyday emotions. After the lecture, you will be able to decipher the differences and demonstrate your understanding through the completion of a worksheet. Now please welcome Dr. Downs. The guest speaker will now speak for 15 minutes. Thank you, Dr. Downs. The participants will then be able to ask questions concerning the lecture for 5 minutes. Now we will hand out the worksheets. Evaluations of the worksheet will determine the effectiveness of the speaker. Now, for a fun activity, we will use magazines to create our 1-minute collage. You all can take 15 minutes to cut pictures out of the provided magazines depicting depression. Once you have your pictures, we will create the collages. When everyone is done, you all will explain why you chose the pictures that you chose. Why did you pick that picture? How does it depict depression in your opinion? The answers should be something along the lines of the person seemed to be distraught or there is a hopelessness look in their eyes. This discussion will last about 10 minutes. The next activity will evaluate what you have learned from this afternoon's session. I want you all to come up with 3 questions that, when answered, will demonstrate that the information today was effectively delivered to you. When you are done, raise your hand. You only have 5 minutes. The participants will proceed to write down their questions. Now, starting on the right, I want you to count off. 1, 2, 1, 2. Now all the 1s get together and all the 2s get together. Amongst your groups, choose the best 5 questions. Take 5 minutes to do so. Now each group will submit their questions to compile a 10-question test. We will put the questions on the smartboard, and I want you all to answer them to the best of your ability. This test will help determine the effectiveness of this program. The goal is for the participants to not miss more than 3 questions. Congratulations! You all now know how to determine if you are just having a bad day or if you should talk to a counselor or seek professional help. Don't be scared or shy, and please don't hesitate to seek guidance. Thank you for coming.